Women's World Health Organization and the private humanitarian group Save the Children say 3.3 million newborns die each year within the first 4 weeks of birth. And chances of neonatal survival are worst in 5 countries: India, Nigeria, Pakistan, China, and the Democratic Republic of Congo. Every 4th fatality is in India. Pediatrician Joy Lawn is one of the study's authors. She says simple health strategies can bring the newborn death rates down.
Not delivering the baby onto a dirty surface, drying the baby, keeping the baby warm, and feeding the baby straight away resulted almost in a halving of the newborn deaths in a very, rural area in India. And that's doable.
Field studies show that these simple steps can prevent at least 2/3 of neonatal deaths each year. Another critical factor is the presence of medically trained personnel.
If you had health workers with the right equipment and the right drugs in these settings, definitely maternal deaths, neonatal deaths, child deaths could be halved.
Simple medical technologies can also help. For instance, a low-cost breathing apparatus called infant air can save the lives of newborns suffering from acute respiratory distress. Rebecca Richards-Cortum is a professor of bioengineering at Rice University, where the device was developed by a student research team.
Our plan is to do first a careful clinical trial at the major hospital in Blantyre, Malawi, to be sure that the device is optimized to provide the best care possible, and then to develop training programs for nurses and hospital technicians.
Professor Richards-Cortum and the Rice team were one of 19 winning entrants in a contest sponsored by the U.S. Agency for International Development, the Bill and Melinda Gates Foundation, and others to demonstrate innovative prevention and treatment approaches for pregnant mothers and newborns in rural settings. USAID Administrator Rajiv Shah says technology has an important role to play in reducing mortality among newborns.
Low-cost resuscitation devices, improved jaundice treatment systems, electronic and cell phone-based blood monitoring so we can monitor blood loss, and new drugs and diagnostics so that people can protect themselves in rural settings where they're not going to have access to hospitals and trained medical doctors.
There is evidence that programs to reduce newborn deaths are starting to make progress, especially in parts of South Asia. But it is in Africa that the progress graph has remained relatively flat. The joint report by WHO and Save the Children estimates that it could take Africa more than 150 years to reach the current newborn survival rates in the United States or the United Kingdom. Vidushi Sinha, VOA News, Washington.